Well, if you're participating in Dry January this month, meaning you're not drinking alcohol for the month, a new call to action from the U.S. Surgeon General may encourage you to keep it up all year round. Dr. Vivek Murthy is calling on Congress to mandate cancer warnings on alcoholic beverages. He cites studies linking alcohol consumption to at least 7 different cancers, including breast, colon, and throat cancers, as his reasoning for the much-needed change. Alcohol is the 3rd leading preventable cause of cancer in the U.S., contributing to about 100,000 cancer cases and 20,000 deaths each year. That's according to the National Cancer Institute.
And current labels warn against drinking while pregnant or driving, but they don't address the cancer risks that can affect anyone. Joining us now to discuss this is oncologist Dr. Eleanora Teplinksy and clinical psychologist Dr. Jeffery Gardere. Welcome to both of you. Such an important conversation that is being had right now around the country. Dr. Teplinksy, I'll start with you. You know, the Surgeon General's advisory highlights that even moderate alcohol consumption, just one drink, he says, can increase the risk of certain cancers like breast cancer by as much as 10%. That seems pretty serious.
It is. You know, under half of Americans actually are aware that alcohol increases cancer risk. And so the calling for the label is really important to educate the public. The World Health Organization states that no amount of alcohol is truly safe, but it's important to provide guidelines for people who do choose to drink even just a little bit.
You know, Dr. Gardere, we've been seeing generational shifts in attitudes towards drinking, with younger people showing a growing preference for non-alcoholic mocktails and beers. Why do you think that is? And do you believe that this trend will continue?
Well, I think the younger generation may be much more into organic foods, much more into exercise, and of course, looking at their mental health and physical health, which can be affected, of course, by alcohol, as the good doctor has explained. Also, the liquor and spirits companies are really on top of this trend. They don't want to lose their money. And so what they're doing is they are promoting and pushing as much as possible a newer trend of the mocktails, of non-alcoholic beverages, and that is to the benefit of the public.
And I do want to follow up on that, Dr. Gardere. Do you see these substitutes as helpful or hurtful for people who are trying to be alcohol-free?
Well, I think for people who really are trying, going cold turkey doesn't always work. And then they, of course, may have a rebound effect where they find themselves now drinking way much more than they did before to make up for that lack of alcohol, trying to keep that desire at bay. So I think for some people, it is really a very good alternative. And look, people get together socially, as we can see on your clip here. And so when people do get together in that way, they do share drinks. It's a way for them to be able to socialize. So if they can do that with a mocktail, if they can do it with something that's non-alcoholic, well, that's even much better.
Yeah, there's so many options now out there as well. Dr. Teplinksy, you know, research has shown that tobacco warnings on cigarettes are effective, and especially showing when they have pictures on them. Do you think that this is a playbook for alcohol as well? Like you were saying, half American doesn't even know that this leads to cancer. So this is a wake-up call of sorts.
Absolutely. I think it's a huge step in the right direction toward educating Americans about the risk, because we can't ask people to make changes if they're not aware of the risk that alcohol poses. And an important point is that alcohol is a class 1 carcinogen, just like tobacco is. And so I think it's really important that we have similar warning labels for both. And as you can see, alcohol increases the risk of multiple cancers: breast, colorectal, liver, esophageal, head and neck, and others. So it's not just limited to one type of cancer. It really affects a significant portion of Americans.
Yeah. You know, Dr. Gardere, talking about alcohol consumption can be a sensitive topic for a lot of people, especially if you have a family member or a friend or a spouse who you feel like is consuming too much and you're trying to find that perfect opportunity to have a conversation with them. Is this now headline that opportunity? How would you address it with someone that may need to, pull back on their drinking?
Yeah, I think people do realize that drinking has been an issue. And now with the Surgeon General's warning. We are taking this in a very serious manner. So I think we're going to start having conversations about this at home. I think certainly having an informal support group of people who are also trying to cut down or stop drinking is going to be very helpful. And we're going to turn to things like dry events, mocktails at certain events, looking at meditation and yoga and other things as a form of relaxation, and getting more into exercise. So these are conversations that really need to happen because most people can't do it alone. If they have that informal support group, if they have the right social events, they can get through this.
I like that. Strengthen community. Wish I had more time to talk with you about this topic because it's so important, especially during dry January. So a good way to start out the year. And I'm sure you guys are happy to hear people talking about this. Dr. Teplinksy and Dr. Gardere, thank you so much for your time.